So, doctor, so what are the first signs people should look for after a tick bite?
Okay, so the classic sign of Lyme disease early on, I mean, is very well known. Is bullseye rash, is a fever, fatigue, back pain, knee pain, joint pain. These are the signs that we see early on. I would like to say that there are a Lyme doctor like me sees two types of Lyme disease. There is the early sign of Lyme disease that all practitioners see. They are well familiar with that. They will tell you bullseye rash, and there are doctors like me who see more chronic Lyme patients. And chronic Lyme patients, I can tell you that I would like to tell you there is less than 5% of my patients that have a bullseye rash. It will be incorrect. I think it's maybe even not 1%. Many people do not recall this famous classic presentation that I've just mentioned. So, very important to know is that after a tick bite, things can be unnoticeable. Lyme disease may happen 24 hours after a tick bite, may happen 25 years after.
Mm.
So, yeah.
So the virus goes dormant in our system?
Yes. Yeah. There is one point of your question which is very important that people should know about it. That there is a tick-borne disease, we will speak of co-infection in a few seconds, called Rocky Mountain spotted fever. It's due to rickettsia. And usually it happens like a flu-like syndrome. Why we should know that is because it can be fatal within 24 hours. This is Lyme disease is very rarely fatal, I have to say, unless it attacks the heart, but it's really very rare. But Rocky Mountain spotted fever is the big threat when we deal with tick-borne disease. So when someone has a flu-like syndrome in July today, don't think it's the flu. It looks like the flu. You better have doxycycline immediately, even if you don't have a blood test. Actually, it's so serious that doxycycline, as you may know, doxycycline is not given to children before the age of 9. This is a rule. But the American Academy of Pediatrics said that for tick bites, they allow doxycycline because doxycycline and azithromycin are the only medications that work well for Rocky Mountain spotted fever. And for that, there is a risk of death. Amoxicillin will not work. Penicillin, cephalosporin will not work. So a child who has a tick bite and later on develop a flu-like syndrome, you have to give doxycycline immediately. It works very well. The threat of death is really eliminated by doxycycline. So it's something really that we have to mention.